Hi, in this video, we're going to be discussing the anatomy of the digestive system. We're going to be discussing both the gastrointestinal tract and its accessory organs. Keep in mind when we talk about gastrointestinal tract, we are referring, or the GI tract, we are referring as this from this long tube that starts in the mouth and it's all connected. It's pretty much a gigantic tube, but it's all connected that leads all the way to the anus. So pretty much the GI tract is this long tube that goes from mouth to anus. So accessory organs are organs that aid in digestion but are not directly connected to that tube. So starting over here we have the lips. You ingest food. Food gets chewed with the teeth, so digestion is already starting. And here is the oral cavity. Hard palate, soft palate, which is mainly composed of the uvula. So when you swallow, the uvula goes up to prevent food to go up to your nasal cavity. So oral cavity, swallow, and it goes to this long tube called the esophagus. The esophagus, let me take the liver out. The esophagus ends right about here. And we're gonna enter now the stomach. So here's the stomach. And the stomach, if we take it out, the stomach from the outside, you can notice there is a greater curvature and a lesser curvature. If we were to open the stomach, the first thing you might notice is all those folds throughout. Those are called the gastric folds or rugae. So here is where the esophagus ends. And this first area, that's the cardia, followed by the fundus, the biggest area, which will be the body of the stomach, ending with the pylorus and pyloric sphincter. Following the pyloric sphincter, we're gonna go to the small intestine. So the small intestine is divided in three regions. The superiormost region called the duodenum, followed by the jejunum, and finally the last third, which will be the ileum. Following the ileum, here we're gonna have the ileocecal valve that leads to the cecum. Just inferior to the cecum, here we see the vermiform appendix. Now let's go back to the cecum. So here we're gonna start with the large intestine. And the large intestine, its names are based on where it's going and its turns. So this first portion of the large intestine, that's the ascending colon. Then the first turn is going to be the hepatic flexure. Why hepatic? Every time you hear hepatic, you just think of liver. And this is where the liver would be located. Hence the name, hepatic flexure. Following the hepatic flexure, now we're going in the transverse colon, then there's another turn, and this will be the splenic flexure. Splenic, because it's very close to the spleen. So splenic flexure, descending colon. After the descending colon, we're gonna have the sigmoid colon until we finally reach the rectum. Here we have the anal canal, and this is where digestion ends. And that's pretty much the GI tract. Now, let's go to the liver, one of the accessory organs. The liver is a very cool organ. It's one of the few organs that can actually regenerate up to maybe around 30%. Not entirely sure what the percentage is, but it's one of the few organs that has some regenerative capabilities. The first thing you're gonna see is the right lobe and left lobe. Right here in the middle, we have the falciform ligament. We flip the liver. Here you're going to see the gallbladder, and the gallbladder pretty much stores bile. Here we are going to have the caudate lobe. Here we're going to have the quadrate lobe. Here we have the ligamentum teres. And here we have a series of ducts. Here, level 2 or 3, there's going to be the hepatic duct. This coming out of the gallbladder is going to be the cystic duct. And finally, this one right here is the common bile duct. The common bile duct leads all the way to the small intestine. So you can see right here, specifically the duodenum. So lipid digestion starts around this area. Right here we have the pancreas. Pancreas to remind you of sugars, right? Because in pancreas is where insulin is made. Here we have the spleen, and that is pretty much the anatomy of the digestive system. I hope that helped. Good luck in your studies.